Hello everyone, my name is Sheena West and I'm going to present you an unfolding case about HIV or AIDS. This is our patient Daryl Jackson, aged 31 years old. And the concepts that we're going to talk about in this case is immunity, infection, and inflammation. Day 1 of our unfolding case. History of present problem. Daryl Jackson is a 31-year-old African-American male who was admitted with a fever, copious watery diarrhea, and right upper quadrant abdominal pain for 15 days. His outpatient stool evaluation disclosed with cryptosporidium parvum and with a white blood count of 2,900. Patient present that he lost 8 kilograms. Paromomycin and antidiarrheal agents failed to stop the diarrhea. He stated that no tenesmus and no blood in the stools. He also stated that he felt warm but did not attempt to take his temperature. For his personal or social history, Daryl is married for 4 years and has one son, age 3, and one daughter, age 5. His wife is engaged with a prostitution occupation for 2 years now. His past history includes HIV infection diagnosed a year ago. He used heroin and cocaine intravenously for 1 year period a year ago. He does drink, smoke, and currently sexually active. He was also diagnosed with an oral candidiasis a year ago. He has recently been working longer hours and stress to support his family needs. So what data from the histories are relevant and must be interpreted as clinically significant by the nurse? So relevant data from the present problem are fever, copious watery diarrhea, right upper quadrant, abdominal pain, and losing 8 kilograms for 15 days. So the clinical significance of this is losing weight quickly from diarrhea can cause dehydration, which can weaken the immune system. And another one is outpatient stool evaluation with cryptosporidium and WBC count of 2,900. And this is a sign of chronic HIV infection, and if this is not prevented, this might result to AIDS. Our relevant data from social history are wife engaged in a prostitution occupation for 2 years now, uses of heroin and cocaine intravenously for a year period. So the clinical significance of this is this could have been the reasons why he got infected from the first place with HIV. And also, working longer hours and stress to support family needs. So with this problem in his hands, can significantly result to more burden to his health as he already have a weaker immunity. As patient care begins, his current vital signs for temperature is 104, for pulses is 120, for respiration is 25, for blood pressure is 90/60, and his O2 saturation is 98% in room air. For the pain assessment, he's provoking palliative. He denies. Quality is aching. Region and radiation is in the right upper quadrant of abdomen. And he stated that it is 6/10 and the timing is intermittent. What vital signs data are relevant and must be recognized as clinically significant by the nurse? So the relevant data for vital signs is the temperature is 100.4. This indicates fever and sign of infection, while pulse is 120 and respiration is 25. And pulse and respiration are high as the body is trying to compensate, while blood pressure is 90/60. Hypertension could be caused by high temperature, pain, and dehydration. Now let's go to the current assessment. For the general appearance, he appeared weak and emaciated with no acute distress. No grimacing but looks worried in his expression. For oral neck, oral mucus dry and intact, respiration, lungs were clear to percussion and auscultation. For cardiac, tachycardia, warm, no edema, S1 and S2 present, and no abnormal beats. Pulses is regular, equal to palpitation at radial, pedial, posterior tibial landmarks, and the capillary refill is less than 2 seconds. For neuro, alert and oriented ×4. For GI, increased bowel sounds and mild diffuse abdominal tenderness, which is most prominent in the right upper quadrant. For the GU, voiding without difficulty, urine clear and yellow, stool GAEC was negative. For skin integrity intact, skin turgor, no tenting present. So what assessment data is relevant and must be interpreted as clinically significant by the nurse? So the relevant assessment data, the patient appears weak and emaciated. And the clinical significance of this is weakness and emaciated appearance could be due to suppressed immune system and watery diarrhea. Another one is oral mucus dry. This indicates dehydration due to presenterial problem. And lastly, increased bowel sounds and mild diffuse abdominal tenderness most prominent in the right upper quadrant. So with right upper quadrant abdominal pain could result to biliary tract disease. The patient is in telemetry monitoring, and this is how his cardiac telemetry strip look like. And for the interpretation, the patient has sinus tachycardia, which is his heart rate is 120. So the clinical significance of this is tachycardia likely indicates increased metabolism due to elevated temperature, pain, dehydration, and infection. And sinus tachycardia is an abnormal heart rhythm and must be investigated further. For the collaborative care, provider orders complete blood count. Because the patient has signs of infection, this is used to determine white blood count and neutrophil lymphocyte with differential for better result. The provider also ordered basic metabolic panel. This helps to determine chemistries of sodium, potassium, and to check renal function such as creatinine and BUN. And this is also used to check if glucose is high or low. The provider also ordered rapid HIV, which determine if HIV is the primary source of infection. And lastly, the provider ordered abdominal CT scan, which this helped to determine if there is concentric wall thickening of multiple small bowel loops. So what diagnostic results are relevant and must be interpreted as clinically significant by the nurse? So these show a radiology report from the CT scan. And the relevant result is this is showing diffuse small bowel thickening. And the clinical significance of this is this result from the parasitic Cryptosporidium parvum. These are the following results of complete blood count. For WBC, it is 2.9 and it is within normal limits. For lymphocyte, it's 15 and this shows high. For eosinophil, it's 6 and this is also high. For monocyte, it's 14.8 and this is high. For hemoglobin, it's 13.0 and this is within normal limit. And for the platelet count is 202, which is also within normal limit. For the lab results of basic metabolic panel, the sodium is 149, which is high. For the potassium is 3.1, which shows low. For the creatinine, it's 2.2, and this is high. For BAN, this is the result is 22, and it's also showing high. And lastly, for glucose, this is 100, and this is within the normal limits. So what lab results are relevant and must be recognized as clinically significant by the nurse? So the relevant labs are WBC, which is 2.9, and this shows low, that indicates viral infection and positive with HIV. And the trend of this is worsening, and this is a red flag. For lymphocyte is 15, and this also shows low, due to infection and losing too much fluid. And this is also worsening, and it is a red flag. For eosinophil, the patient gets 6, while monocyte is 14.8, and for these two, eosinophils and monocytes are due to body is trying to fight parasitic infections in the body, and both shows high. For the hemoglobin is 13.0 and this shows stable, and also for platelets is 202 and also shows stable result. While the relevant labs for CMP, the sodium is 149, and this is due to dehydration and loss of body fluids result from prolonged diarrhea, and the trend of this is high. While potassium is 3.1, this is due to excessive loss of potassium from diarrhea, and this is a worsening, which is a red flag. For creatinine and BAN, creatinine has a result of 2.2, while BAN has 22. Creatinine and BAN are high due to the dehydration, and both have high result, while glucose is 100, and this shows a stable result. Other lab that are ordered is CD4 count, which result to 190 and it shows low, while the HIV RNA level or the viral load result to 56,000 and this shows high. So what lab results are relevant and must be recognized as clinically significant by the nurse? So CD4 is 190 and this is less than 200. That could indicate that it developed to AIDS, classified as stage 3, or if developed certain opportunistic infections. While the viral load is 56,000 copies per ml. So this viral load reports the number of HIV copies in the milliliter of blood. And as the viral load increases, virus continues to replicate. These are the treatments that are used with a patient's condition. So for the medications, a combination of azithromycin and nitazoxanide used to treat bowel infection caused by a parasite, and a continuation of antiretroviral therapy to reduce viral load and increase CD4 count. And for the interventions, the provider ordered acid fast bacillus blood cultures to confirm mycobacteria growth, especially for M. tuberculosis. At telemetry monitoring, to continue monitor vital signs and weight, use good hand washing technique, and assess heart and breath sounds. Lastly, fluids. Administration of lactated ringers to help with rehydration. Now let's go to the second day of our unfolding case, the continuation of care. On the second day in the hospital, it was known that 20 days ago, Mr. Jackson went home to visit his family and went to the lake. He confirmed that he swallowed some water from the lake. He also confirmed that he was not compliant in taking his antiretroviral therapy since the primary diagnosis. The provider also ordered liver panel to test to see if liver were not affected. Lipid panel test was also ordered to help rule out biliary tract disease. And BMP was ordered again to see if fluid balance is improving. It was also recorded that he lost 300 ml of watery stool from yesterday. What is the primary problem the patient is most likely presenting? The patient is presenting that his HIV is progressing to AIDS due to lower CD4 count and higher viral load count. Cryptosporidium parvum as also a secondary opportunistic infection. Assessment findings. So the current vital signs, temperature goes from 100.4 now to 100. Blood pressure, from before it was 90/60, now it is 98/70. The respiration rate is 20. Heart rate is 98. O2 sat is 98% on room air, and pain is 5/10, while the weight is now 62 kilograms. The stool amount is from 300 ml, now it's down to 240 ml. From the assessment, what data is concerning and why? So one of it is pain, because right upper quadrant could indicate cholecystitis problem or gallbladder infection, which is not good for his declining immune system. And the other one is the stool amount. Even though the amount is decreasing, this can still worsen because of his dehydration problem. Laboratory result monitoring. For AFB result to rule out M. tuberculosis was negative. As you can see here, this is an AFB stain which shows a negative result. And it is then confirmed that the patient has no tuberculosis Complication. For the liver panel test, the AST is 50 and ALT is 62. This liver test shows elevated and further investigation is needed. While the BMP, sodium is 145, potassium is 3.3, creatinine is 1.8, BAN is 20, and glucose is 98. This shows that the patient rehydration is continuously improving. While the lipid panel test, the total cholesterol is 230, HDL is 42, LDL is 110, and triglyceride is 200, and all these results are elevated. Further monitoring. With the previous CT scan, biliary tract disease was not ruled out because liver panel test and lipid panel test are not within normal range. Kidney and stool frequency will be monitored continuously as he is immunocompromised patient. For the medications and treatments, they're still continuously using nitazoxanide 500 mg administered twice daily, and this is helped to resolve diarrhea problem. And the patient is improving as stool is not as frequent and the amount of stool is decreasing. And they're also still using antiretroviral therapy, as continuous administration help increase CD4 count and reduce the viral load. They are also using still lactated ringers as continuous use of fluid therapy. Patient weight and BMP levels are showing some improvement, while they added loperamide as this can help reduce stool frequency. What additional treatment should you anticipate for Mr. Jackson to improve his CD4 count results? So he needs strict adherence to antiretroviral therapy. He also needs consumption of healthy diet such as eating vegetables with his meal, and also engaging in regular exercise and avoiding smoking. Now let's go to Mr. Jackson's Day 3's unfolding case. Continuation of care. Upon assessment, Mr. Jackson's general appearance is grimacing in pain, complaining of right upper quadrant abdominal pain. Current pain is 7/10. Provider ordered ultrasound and magnetic resonance cholangiopancreatography, which is MRCP, to further investigate biliary tract disease. Liver panel test was ordered again to make sure that liver is not further deteriorating. CD4 count was also ordered. A blood test for hepatitis A, B, and C is also ordered by the provider. So which organism is likely to be found in the biliary tract in this patient? It is Cristosporidium have been found, often simultaneously within the biliary epithelium of patients with AIDS cholangiopathy. For the assessment findings, current vital signs, temperature is 100.2. Blood pressure is 96/65. Respiration rate is 22. Heart rate is 99. O2 saturation is 99% on room air. Pain is 7/10. Weight is 63 kg. stool amount from 240 ml now down to 210 ml. The general appearance is grimacing and shows weakness and fatigue. Now let's go to the abdominal assessment. So upon auscultation, a low-pitched bowel sound in all four quadrants are heard, and this is the sound of it. And upon palpation, right upper quadrant tenderness and guarding is present. For the imaging monitoring, in this picture, you can see here, an ultrasound shows portal hepatitis Cristosporidium cholangitis, showing a tapered narrowing of dilated distal common bile duct and wall thickening. And for this picture here, it's an MRCP shows strictured intrahepatic ducts and extrahepatic biliary ductal dilation, a narrow distal CBD, and papillary stenosis. With this combination, provider confirmed that it is a characteristic of AIDS cholangiopathy. What is the optimal management of this patient's condition? AIDS cholangiopathy is best treated by sphincterotomy or surgical drainage of the common bile duct. This is the most effective method that leads to a rapid relief of pain which may last. For laboratory monitoring, CD4 count is from 190 now down to 170. Patient CD4 count is worsening, and AIDS cholangiopathy is now suspected. Hepatitis A, B, and C are negative result. For liver panel test, AST from 50 to 52 and ALT from 62 to 65. And liver is now further deteriorating. The medications and treatments that is added now to the patient's treatment is morphine, which this helped with the patient's pain after several pain assessment, which patient pain subsided now to 2/10. And also continuous use of antiretroviral therapy or ART, which is continuous administration to help restore immune function and prevent CD4 count to further deteriorate. While another one that is continually used is nitazoxanide. And frequent stooling is improving as stool amount is decreasing. Now let's go to the procedure done to the patient, which is endoscopic sphincterotomy. And this procedure is used to remove gallstone and bile duct blockages. And this is how it looks like during the procedure. This is also done to help provide symptomatic relief of abdominal pain and improving the drainage in the biliary tree. What can endoscopic sphincterotomy help in his diagnosis? Endoscopic sphincterotomy improve pain score and cholestasis, decrease in biliary dilation, and decrease progression of sclerosing cholangitis, especially in patients with AIDS cholangiopathy if it is not resolved, the dysplastic process in the biliary epithelium can lead to the development of cholangiocarcinoma. Now let's go to the day 4 of Mr. Jackson unfolding case. So for the continuation of care, acid's fast stain of stool is still positive for Cryptosporidium parvum. As you can see here, this is a positive acid stain. Continuous administration of nitazoxanide is needed. Upon assessment, Mr. Jackson's pain subsides to 2/10. Patient is more lively and talkative. Alert and oriented ×4. Patient does not have the urge to frequently defecate, and patient's appetite is improving. What other tests can be used to detect Cryptosporidium parvum? So one of it is enzyme-linked immunosorbent assay or ELISA test, which is used to detect cryptosporidial infection and determine the prevalence of intestinal parasites in HIV seropositive and seronegative patients with diarrhea. Another test that can be done is polymerase chain reaction or PCR test. This is used to identify Cryptosporidium at the species level. Assessment and findings. For day 4's vital signs, temperature is 98.6. Blood pressure is 100/70. Respiratory rate is 19. Heart rate is 95. Oxygen saturation is 98%. Pain is 2/10. And the weight is 64 kilograms. Stool amount from 210 now down to 190 ml. And for the abdominal assessment, there is no guarding present and all 4 quadrants are active upon auscultation. Laboratory and monitoring. One of the laboratory that is ordered by the provider is erythrocyte sedimentation rate or ESR and C-reactive protein or CRP. This is ordered by the provider if inflammation level is still elevated, especially the patient is experiencing an infection. ESR result is 35 mm/hour, which is slightly elevated. The CRP result is 14 mg/liters, which is also slightly elevated, and is concluded that infection and inflammation is still present. And another lab result that is ordered by the provider is basic metabolic panel, which sodium is 142, which is within normal limit, potassium is 3.5 and also within normal limit, creatinine is 1.4 within normal limit, BUN is 19 within normal limit, and glucose is 98, which is also within normal limit. And BMP is ordered to see if dehydration and hypokalemia is resolved due to diarrhea. What is the prognosis of the patient with AIDS cholangiopathy? Generally, it is poor because of disease association with advanced stages of immunosuppression, especially if with the presence of multiple opportunistic infections. With strict medication adherence to ART, mortality is then reduced. For the medications and treatments, the provider ordered antiretroviral therapy, which are Riataz or atazanavir to continue increase his CD4 cell counts and decrease viral load. And also Norvir or ritonavir to slow progression of HIV to AIDS. And another medication that is ordered is orsodeoxycholic acid or orso. And this is used to improve abdominal pain and normalization of liver chemistries after sphincterotomy. Other treatments that is used is fluid therapy, and the use of lactated ringers improve potassium level and dehydration problem. And as a result, the patient is continuously gaining weight. What nursing interventions should be initiated to the patient? So continue to assess for indicators of opportunistic infections. Place the patient in a private room whenever possible. Use good hand washing technique or use alcohol-based hand rubs. And also perform a complete physical assessment at least every 4 to 8 hours to identify any changes from the baseline assessment. Now we're down to the patient discharge. Since the patient diarrhea is now improved, the provider decided that the patient can be discharged to home. Continuation of taking nitazoxanide is advised to completely eradicate the infection. Follow-up visit with the provider after 1 week is scheduled. Continuation and medication adherence to antiretroviral therapy is strictly advised to the patient to increase CD4 count and decrease viral load. Patient is also advised to visit provider after 2 weeks to get CD4 count and viral load tested again. And education is provided to the patient and all information is shared or printed out in a hard copy for his record. And these are all the references I use for this unfolding case. The end of the unfolding case study about HIV or AIDS.